They shouldn't interfere with our life. They shouldn't interfere with the way we look. They should merely be there when you want them and not there when you don't want them. Okay, so the treatment of wrinkles. We're going to be covering an introduction. We're going to try and understand why we want an aesthetic practice. Why Botox? We're going to be covering the basic science of it, hopefully, but not in too much detail. We don't want you falling asleep. The contraindications and the cautions, obviously, and any complications that we might look out for. Patient assessments, that's going to be really important because we've got to assess our patient before we can actually do anything for them. And the Botox itself, okay? We're going to be looking at, hopefully, the preparation, the storage, and the dilution. We'll also look at the costs. Facial anatomy. Horizontal lines, we all know about those. The glabellar frown lines, that's just describing an area of the face that's just between our eyes, just above the nose. Crow's feet, perioral rhytides, those are the lines in and around our mouth. Platysma bands, these bands, some people have lacing. That's, as you know, people who age tend to have two basic traits. They have what appears to be aged hands and aged necks. So a lot of people are asking for anything that will help. Okay, we're going to be talking about injection techniques and marketing. That's extremely important in your practices or eventual practices. The cost of marketing, yeah. The pricing of the product. Profit, all important. Profit. Okay, advanced uses. I might just touch on that right at the end. Just to give you a taster. And hopefully we'll have a live demo with some mini workshops as well. Okay. So why develop an injection practice? Cosmetic trends favour minimal invasive techniques. There's normally no downtime, so it's considered a lunchtime procedure. Non-surgical procedures, well, they're growing at a faster pace than surgical procedures, and it's a want as opposed to a need. So why an aesthetic practice? It's ever growing, exponentially. It's very lucrative. It's extremely popular. It's a want, not a need. And celebs are onto it. You only have to look at the local paper or the national newspaper. This is a typical headline in the Mail not so long ago. Botox fillers and high-tech face creams all mean 40 doesn't look like it used to. So, the world's your oyster, really. Everybody's crying out for it. Okay, so media pressure. Yeah, everybody's talking about size 0. Let's have a look at Victoria Principal. Let's have a look at Victoria Beckham. But care, there's the syndrome called body dysmorphophobia. And that's where people are expecting treatment for something they're not actually suffering from. It's easy to learn, as I mentioned. Who's been doing it? Well, up until recently, it was just doctors in private clinics and hospitals. And dentists got onto it because they've been working with the head and neck all of their practicing lives. They know about the muscles of the facial expression. They know how to inject already. So it became a logical thing to do. So they've been doing smile makeovers. Aka, 10 years younger. So everybody looks at that and think, I want to smile like that. Once they've had the smile, it's like a painting, the Mona Lisa painting. You don't frame it with a B&Q frame. They want the frame to be a work of art as well. Okay, so what next? So we started doing lip lines, the perioral rhytides. We started looking at wrinkles because they said, well, if you can do that, you're a cosmetic dentist, you're an aesthetic practitioner, what else can you do for us? So it's a supply and demand. So it's not a fad. I'm a fad. I'm a facial aesthetic dentist. Okay. What about nurses? You possess the necessary foundation skills, don't you? You're already well trained in cross-infection control. It's extremely important. You know the anatomy. You did it in your basic sciences. Muscles of facial expression that I mentioned. Frontalis, procerus, orbicularis oris. Corrugators, those muscles that actually causes our eyebrows to come down and to the middle. And then orbicularis oculi, our eye muscles. Okay, the sphincter muscle. Facial nerves, vessels, we all know about them. We learnt it at dental school, med school, nursing school. Physiology, you're well versed in that. On a day-to-day basis, you're communicating with your patients, so your communication skills are already top-notch. All it means is applying them. You have the necessary chairside skills. And you have the manual dexterity. You give injections. You're actually part and parcel of the health service or the delivery of the health service. You're artistic. Manual dexterity is extremely important. And so I want you to become fans, facial aesthetic nurses. Okay? Okay, anti-aging treatments, what are they? Well, why? They're minimally invasive, we talked about that already. They're cosmetic. Classed as a rejuvenation therapy. Less is more. It's all about subtle changes, yeah? Subtle changes. And it's reversible. It's not permanent. Don't like it, goes away after 3 months. Okay? But again, going back to the previous sentence, subtle, less is more. So don't put too much in, suddenly get complications that you don't want to deal with, especially when you're starting out. It's extremely safe. It's the most researched material that I can think of. It's a lunchtime procedure. People want to do it, have it done at lunchtime and get it over and done with. Nobody need know. Okay. And it's target specific. What about the patients? What are they looking for? They're cosmetically aware, like I already mentioned. They're reading the magazines, they're seeing it on the media pressures there. And they're encouraged. Who are they encouraged by? Well, the obvious people are wives, boyfriends, girlfriends, husbands. Yeah, definitely. But patients are extremely secretive sometimes. If you want to talk to them about it, they say, oh no, I haven't had Botox, not me. And others are quite open about why they've had it, but they are secretive as well. They want to improve their appearances. They want a feel-good factor. In these days of recession, everybody wants to feel good. They want better jobs. They want to look good. They want more compliments. Who doesn't thrive from having a compliment? Your ego being stroked. So if you look good, you get more compliments. Beautifying, yes. There's a chap called a metrosexual these days. Chaps that like having stuff done, facials, manicures, pedicures. Why not? There's nothing wrong with looking after yourself. And we want to recapture our youth sometimes. And the most important thing, you want to attract a mate.